Javon and Raul to leave the room, so we'd like to request that you do the same for your children. Today we're talking about how regenerative stem cell therapy treatment for erectile dysfunction. We welcome back Dr. Irwin Goldstein from San Diego Sexual Medicine, Alvarado Hospital. And today plastic surgeon Barry Handler is on the show with us as well. Hi guys.
Hey, thank you so much.
Hey, thank you for having the guts to come on TV and talk about stem cells and erectile dysfunction, as it is what you do for a living in part. This is breaking news. You're using stem cells to help men with erection problems, right?
So stem cells have been used in a variety of cardiovascular issues, plastic surgical issues. A lot of orthopedic procedures engage stem cells.
Right.
These are cells that make themselves, and they make other cells. For us in sexual issues, we want them to do blood vessels and muscles and nerves, and these are cells that make that. Plus, they do a third thing. They release growth factors. So blood vessels, little tubes, have stem cells in them. So if we can find blood vessels that are sort of extra and we don't need them, like in the abdominal wall, the fat area.
And that's where the plastic surgeon comes in.
And then Dr. Handler does his magic with liposuction. He gets a lot of blood vessels. We're not really interested in the fat, but we're interested in the blood vessels. And we send them then to a doctorate who removes those special stem cells from the lipoaspirate, which is the material that Dr. Handler does.
And then you do an injection or injections, and then the stem cells do all the work.
And they do. We have
it
now
is working?
done. This is the first study in the United States. We're the only site to do this. It's FDA approved. People can come into this trial by calling our office, and they actually get paid to be in the trial. Sort of interesting.
Interesting. This is big news. Dr. Handler, how does this work for you? You're a plastic surgeon. You're just literally doing some liposuction here, and this is just part of the process?
It's pretty much what I do on a daily basis. We just make little holes in discrete areas on the stomach, and we numb the patient up, put a wand in and extract the fat, and then I do some coarse filtering with a special filter, and then I hand the fat off to Dr. Goldstein, where he takes it to the office, and the real magic happens.
I think this is fascinating. All you guys working together.
Win twice.
The patients win twice because they get
liposuction.
Get
a little less stomach fat.
Well, I want to kind of go back and talk about erectile dysfunction in the first place. A lot of people are very embarrassed about this, but this is extremely important. If a man starts to have a problem with an erection, it could be something else. It could be heart disease. I wrote down a few things. Correct me if I'm wrong. It could be sort of a preceding or antecedent symptom of Parkinson's, multiple sclerosis, heart disease, alcoholism, metabolic syndrome, stress, depression. I mean, this is not something to be embarrassed about, right? We
just heard the report that 60 to 7% of aging people are obese. It's sort of like the canary in the coal mine. The first sign of people with cardiovascular disease is actually erectile dysfunction. The blood vessels are so small, and you can gauge their dysfunction by your identifying less hardness, that you can actually pick up early heart disease.
You know what? That is great information for people. You know, I mean, it's like, you know, it's nothing to be embarrassed about. It could be a sign or a symptom of something. If you go to the doctor sooner than later, it could save your life. But so do you go through that process with the guys in the study first?
We do.
So you go do the full examination to make sure that there's no heart disease or anything. And what if they do have heart disease?
Well, we would engage, of course, we have this biopsychosocial thing. So we do a sex therapist, physical therapist, and myself. Plus, we engage a lot of hormone testing. We measure their blood pressure, their cholesterol, all that stuff, so that we can truly gauge the cardiovascular phenomenon. You know, there are pills and shots and devices for men with erectile dysfunction, but now with Dr. Handler's engagement, we're going to offer ideas for the first time in history to actually cure the dysfunction rather than sort of add a pill at the time or a medicine at the time or a device. And this is sort of important. If we can actually show benefit, then more people do research in this area, and it'll be very exciting.
That's incredible. I'm going to ask the question everybody's thinking. You're doing injections, and can you talk about the injections? And is there any pain?
Yes. So
is there any pain? I think that's what everyone wants to know. Is it painful?
Yeah. So a little bit. The person comes in. We want them there early in the morning, say 5 in the morning, so they're already tired. They go to sleep under anesthesia. Dr. Handler spends, let's say, an hour with them. He modifies the usual liposuction. It's not the regular liposuction. We have to be careful to keep the cells alive.
Okay.
So he does some very special things. He's a very talented person.
So they're actually not...
So wait a sec. So then the cells come to us after the PhD works on the cells.
Okay.
Then we numb the skin in the area, and when we place the needle in the cells, they don't feel a thing. But they have come from the hospital, the recovery room. We wheel them in a wheelchair to our office.
Okay.
And then when they come, the cells are ready, and we marry. The cells are placed within the same person. They're the person's cells. They're not from someone else.
Right.
Within 4 hours of Dr. Handler's magic.
Okay, maybe I should ask the question another way. Does it hurt?
So there's no pain. Dr. Handler, they're asleep or numbed?
No, when you get in the mix. We know that they're asleep with him. You know what everybody's thinking.
No, but there's no pain because they're numbed. We actually
a
use
topical
the
numbing. They're alert and awake, but they're just numb. They can't feel a thing.
Actually, some of the cases, the patients did not want to go to sleep, and in certain selected individuals,
Right.
we can do it with them awake.
That too.
We always use large amounts of lidocaine in the fat itself before we harvest it. Interestingly enough, it tends to leak down, and many times they show up in his office and they're already numb.
They're all totally numb. This is not a big deal for pain.
But of course,
and
but
they go right home afterwards. They don't have to stay in the hospital.
How much time until they start to see some?
Well, that's fascinating. We've seen people now. We have, I think, about 1.5 years of follow-up. And it's a different, we see people by 6 weeks and 3 months really seeing nice results, but it continues.
No, like the day after? I mean, can you notice the day after or 2 days after?
Not really. I mean, these are cells. They have to make themselves. It takes a little while.
Do you think down the line it could be standard of care?
Well, we have to show, of course, that it works. We haven't had any bad problems. That's the FDA wanted to see that we're not harming anybody. So we had to do 3 people and follow them for a year before we could do this. So we've done that, and nobody has done bad. But it would be very cool. I mean, if you had the choice to take a pill each time, or to be cured, or to take medicine by injection each time, I mean, you know, the thought of losing some abdominal thing here and getting cured.
Oh, I'm fascinated by this stuff, man. I think it is so cool what you guys are doing, and I think it's a really big deal. It's nothing to be embarrassed about to have erection problems. You know, it's like could be a symptom of something else, and it probably is. You know, you get that other thing fixed, you get yourself fixed in your office, and then you know everybody's happy.
Our next challenge is to do this in women. So we're already thinking of who to do it. So we have women who have cervical cancer and they get radiation. So their organs near the cervix gets radiated, and it's not. So to place stem cells there and make them more.
Will you let us know when you do that?
Yes.
Let us know. Keep us
do
posted. Dr. Goldstein, Dr. Handler, thank you for being here. Keep us. I know all the guys that are watching are like,
thank you for doing this.
Does it hurt? Does it hurt? Guys, thank you very much. All right. To get in touch with Dr. Goldstein, it's San Diego Sexual Medicine at Alvarado Hospital. Just visit our website and click on the Scene On tab. Erica, you can go get Raul and let him back in the room.
No, he needs another minute, I think. Thank you, Christy.